Hi ladies, it's Elisa and it's time for an update video about my frozen embryo transfer. More specifically, the pre-testing that I had to do, the procedural part of it. Obviously, starting the frozen embryo transfer was blood work, and we had to take the medication. I don't remember what the name of the pill is, but it's antibiotics that Brian and I have to take. It's like 4 pills that you have to take all at once. Apparently, that's how my they do it now. They didn't do it that way. We have to take the pills, all 4 pills, the night before these procedures. So I was lucky enough, my doctor informed me that I was going to do a 3-for-1 procedure. So it started off with an internal ultrasound and with the wand that is our friend, just to check on my ovaries, make sure that I didn't have any cysts. Because when I did my IVF back in 2015, I did develop some of those. So there wasn't any. They looked great. The next step, so that's normal, it was very easy. To sit there for a few minutes and have all 3 done at once was like, oh, but at least it was better than having like 2 different appointments or something. And then the next one was a mock transfer. The mock transfer is basically when they insert the catheter. That's, I assume, pretty long, and make sure that it can go all the way up through your cervix and stuff. And yeah, and it went in just as easy as they have ever done. I've never had a problem with that. I know some women do have problems with that, so I was lucky enough that that was relatively simple. And then was the saline sonogram, because they want to make sure that everything is fine in your uterus. And so they insert the catheter with the balloon that inflates, and they insert the saline to expand your uterus to make it, because it lays flat, and then they bubble it up so that they can use the ultrasound wand again to take a gander in there and make sure that everything looks good. And I hadn't really thought about it before the procedure, but when she's talking about the procedure before we had started, and we're in the room, and I was like, oh, my birth was pretty difficult, and I did hemorrhage, and it was very terrible after birth time. So I was actually immediately got scared that what if I have scar tissue in there? What if the inside of my the lining of my uterus is a little damaged, because that was such a rough go. But she assured me that after we did the saline sonogram, everything was fine. Everything looked great. She didn't see any scarring. So as far as we know, all the results from that test, those 3 tests, they all looked fine. Looked at my uterus should be a happy, warm, comfy place for another little embryo. So yeah, that's all that happened then. I mean, it was overwhelming to have, I think, 3 things done at once, but it was also like bam, bam, bam. And I didn't take anyone with me. I went by myself because, again, there were procedures that I've all done before. Nothing was new to me. And the nurse that is at that particular location is very, very nice. And the doctor was very, very nice as well. So they really did put me at ease, and they make it so much easier. She's like, okay, we're only going to do 1 more thing. It's only going to take it 2 more seconds. And, she was very walked me through it. And unlike the doctors in the past, they didn't show me the catheter and show me the wand and all of this is how much saline we're going to put in you. I mean, she didn't do all of that. So it was more like, okay, I'm just going to handle all this down here. You worry about you. And so that was better. But yeah, so that's one whole thing off of my checklist. So yeah, one more big step there. I need to stop saying so yeah, I'm sorry. But there you have it. I don't have anything else for you guys. So this is just a really quick video. Saline sonograms, really not that big of a deal. The mock transfer wasn't that big of a deal. And of course, the ultrasound is the same thing that we will hopefully be getting throughout this entire process. We do have our injection training next week. And so that's going to be crazy because it has been over a year since we've done the injection training. They wanted us to do it again, even though it hasn't been a year since we've done the injections. I mean, we were doing progesterone all the way up until 12 weeks pregnant with Sawyer. So, I mean, we were doing it for a long time. And before that, I mean, the little shots, the Lupron and stuff, super easy. So, but I just wanted to let you guys know that that's all happening. We'll have the injection training Wednesday, and then I start my Lupron shots on that Friday, which is just insane to me. And then after that, everything just snowballs and goes really quickly. Um, so yeah, I will keep you guys informed and update you guys when there's something to update with. And I'll be talking to you ladies. Thanks for watching. Bye.